Right now for you at 4:30 as the vaccine rollout continues, so many more questions keep coming into the newsroom. We want to answer as many as you've been sending. We're trying, and we've been addressing it each and every day this week. So joining us live this afternoon is Dr. Michael Rajkumar, an infectious disease specialist from Backus Hospital. Doctor, thank you very much for being here with us again today.
Thank you for having me.
Well, as I said, we are getting so many questions, and I know you get questions all the time, so I want to get right to one here from Kathleen in Ledyard. She wants to know, do you have to get the second shot in the opposite arm from where you got the first shot?
There is no recommendation as to which arm you need to take. You can take it in the same or the other if you feel comfortable. The vaccine is given, the first dose basically primes your body for the antibody production, and the second one gives the boost to get more antibody production. There's no difference in whether you get it on the right arm or the left arm.
Okay, just make sure you get it, right, doctor? Don't miss that second shot.
Absolutely.
Yeah, absolutely.
Absolutely.
Now, Karen of Ashford is asking, if you had the shingles shot, is it okay to proceed with the COVID-19 shot, or should you wait a period of time?
So what has happened is since these mRNA vaccines are novel vaccines, and we are still gathering data on the adverse reaction, the side effect profile, that is one of the reasons that CDC has said to take the vaccine separately without, not in conjunction with other vaccines. As you know, children onwards, we give vaccines, multiple vaccines at the same time. However, for this particular vaccine, we have not. And the reason is, as I stated, to collect data. So the general time frame, I think, would be a 2-week time frame would be appropriate, and any time before or after 2 weeks from another vaccine, you can take the COVID vaccine.
Okay, good thing to keep in mind. Thank you. Now, we have a question from Amston. This is a good question here. Should one take Tylenol or ibuprofen prior to or immediately after vaccination to mitigate any side effects?
No, you shouldn't preemptively take anything. Not everybody gets, the fevers and other things. Most of the times you may just get by with just some soreness in the arm that can be easily dealt with just icing. Now, if you get a fever, you can contact your primary care physician and then consider taking over-the-counter Tylenol, only if you have fever. Now, again, we must understand the reason why I want them to talk to the primary care physician is to understand if this is all from the vaccine or something else, because we're not testing everybody for COVID before they get the vaccine. Someone could have been in the pre-symptomatic time frame when they got the vaccine and may happen to have the symptoms of COVID. That's why a doctor would be able to ask the right questions, especially regarding respiratory symptoms and other things, and then may be able to understand if this is indeed from the vaccine or not. And if it is from the vaccine, by all means, over-the-counter medication is recommended.
But bottom line, doctor, don't be afraid. Folks should get the shot.
Absolutely. The more people get vaccinated, we will be in a better place. As you know, Dr. Fauci keeps saying the herd immunity, we can only reach there when we get more people vaccinated. So we all are encouraging everybody to please go and get vaccinated.
All right.
When your turn comes, of course.
Better days are ahead. We're all hoping. I know you are too, doctor. Thank you. And thank you to all of your colleagues as well. We appreciate all you've done. Dr. Rajkumar again with us this afternoon. Now,